Hi, this is Dr. Bob Dannenhoffer with another of our Facebook Live events. It's March the 30th, and this is another one of the updates. So the overall update is that COVID is spreading widely throughout the world. We're now over 700,000 cases and many, many deaths. So this is really spreading sort of as we predicted. In the U.S., it's spreading very rapidly, especially in New York, and we're also starting to see big spreads in Massachusetts and in Michigan and Louisiana. So it's really worrisome. The good news is that it slowed down a little bit in Washington and California, I think because they've been so good at doing social distancing in the Seattle area and the San Francisco area, but we do think the disease is very widespread. In Douglas County, we're up to 8 cases now. And so we've seen a really rapid increase. This time a week ago, we were just 1. So to go from 1 to 8 suggests that we've got a number of cases. About half the cases come from the hospital testing, and about half the cases come from our screening clinic. So our screening clinic has now had some positive cases from last Tuesday's clinic. So we were expecting to get some, and now when we've seen them. People have asked where are these cases from, and I will tell you they are from all over the county. So as far as the county reaches, these are from all over the county. There is not one area we can say that people got this from, not one area that people have been shopping, not one area that people have been to. So I think you have to assume that it is everywhere and that you have to be very cautious about protecting yourself and protecting others if you're sick. So we're going to take questions tonight. So if you have questions, put them on the Facebook Live page and we'll go ahead and look at that. We do have another clinic tomorrow, screening clinic tomorrow at 12:30 at the fairgrounds. Again, you need to have an order through your doctor. Your doctor faxes it in, and then we'll set up a time. I think we might have a few openings still for tomorrow, so if you get it in. Bizarrely enough, one of the factors that's limiting the amount of testing is these swabs. So the swabs are these things that go in your nose about 5 inches. You twirl them around and take them out. They cannot be regular Q-tips. They have to be special Dacron or rayon flocked swabs, and they had to be very thin because if they're thicker, it's hard to get it in the nose. There is a worldwide shortage of these swabs. These swabs are made in Bergamo, Italy, which is right outside of Milan, which is where much of this problem has come from. And so there's a worldwide shortage of these swabs. So it turns out that we only have enough swabs to last us for tomorrow and Friday, and after that, we may actually be limited by these swabs. So Sydney asks, are we any closer to finding a treatment? The answer is not. I just looked at the website this afternoon, and the only trials that we have so far are negative trials. That means people tried something and it didn't work. There are a couple of antivirals that people tried and they didn't work. So that is disappointing. I know chloroquine was all the rage last week. Some of the, at least the anecdotal data that's come out about chloroquine is that it doesn't seem to be that effective. So sadly, I don't think we're any closer to finding a treatment, but I think people are really carefully looking. So we keep hearing about don't take ibuprofen, to take Tylenol. What's the current? Kathy asks. The current on this is there's not good data on this. There was one person in Europe who suggested that ibuprofen was associated with a worse outcome, but nobody else has seen that. So early on in these diseases, you may have 5 or 6 patients, and something happens with these 5 or 6 patients, and then you point it out. But I think that the current feeling is that either ibuprofen or Tylenol is good. But since Tylenol works perfectly fine for the fever, I would probably just go with Tylenol. So would you expect the virus to peak, and when will it leave? So it's going to leave when we get a vaccine. So when we get a vaccine, then the virus will be gone, because at that point you'll have enough immune people so that the disease can't spread. Not enough people are infected now to get immunity. So for example, with the flu, maybe 20 or 30% of people have immunity to it because they've been exposed sometime in the previous. But since this is a totally new virus, nobody else has immunity. So we can't really expect for community immunity to work until we get a vaccine. And so the hope is that we'll go through this bad time where we have a lot of cases and then be able to keep it so that there are a couple of cases. When there are a couple of cases, we can probably keep those under control, and we certainly won't overwhelm the system. So has the hospital or Mercy been able to obtain more PPE, asks Yeah, they really need more. PPE, or personal protective equipment, is going to be, I think, the major pinch point in this whole thing. Mercy has done a very good job at seeking out new kinds of PPE. They've done a pretty good job at controlling their use of PPE. We at DPHN just happen to have some that we're sharing with them, but this only goes so far. You know, these people who are sick, especially with coronavirus, can be very contagious, and so you need to use a lot of protective equipment. The hospital is working very hard. I was on several calls this afternoon about things that they can do to help preserve PPE and to make it last longer. So has the hospital or DPHN been able to donate additional PPE for healthcare providers? So the deal on PPE is that the two most important areas are the hospital and EMS. And so we have prioritized DME for those two areas, because those two areas can't put a sign on the door say we're closed, we ran out of PPE. They have to continue. And so we've really focused almost all of our efforts towards the hospital and to the EMS. That means that clinics who are still doing good work will sometimes be short, and we're trying really hard. We're trying with, for example, when patients come in and should have a mask, we're using the homemade masks. We started delivering those today, and we'll keep delivering those this week. We are using all kinds of other things, so face shields that we've gotten for gowns, where we're using Tyvek painter things, so we're able to go ahead and do that. DPHN collected a store of PPE over the last few years, and we are giving that out to the hospital and to EMS. So is it okay for somebody to work in public if they claim to have a head cold but no fever? You know, we're asking anybody with respiratory symptoms, which is cough or sore throat, to stay home. One of the things we know about COVID is some people have mildly symptomatic cases, but they may still be contagious. So if you have any respiratory symptoms, please, please, please stay home. So what are most cases in our county elderly with underlying health issues? It turns out that these, most of the cases we've diagnosed have been elderly people, because they tend to get sicker with it. Although we think that if you had an unlimited number of tests and screened 20, 30, and 40-year-olds, we'd see plenty of positives in that group. We worry more about the elderly because they get so much more sick with this than do young people. So Sydney asks, what do you think the U.S. numbers are going so much higher than other countries? So let me try not to get political here. U.S. is a big country, so our numbers would likely be higher than Korea or Italy. I mean, we're about 6 or 7 times as big. The second thing is we were really late on the testing, and you know, we were really behind the 8 ball on the testing. So that may be why our numbers are so much higher. The other thing is we have kind of dispersed cities, and each of these outbreaks is separate. So the outbreak in New York is separate from the outbreak in Buffalo, New York, but they'll come at different times. So I think that's why the numbers are higher. So Michelle asked about COVID-19 protein encased in a lipid layer. So the question about how viruses look is one. There is a lipid layer, so that's why bleach and other things work very well. Actually, we're not exactly sure about the proteins yet. They have been sequenced, so you could figure these out. So Michelle, I'd send you to the COVID, it's called the COVID sequencing site, and the COVID sequencing site will tell you all those things. So what are the stats of people who die from the flu versus people that die from COVID-19? So this is a great question. So people said, well, you know, we have people who die every year of the flu, and so what's the difference between the flu and COVID? So we know that every year tens of thousands of people die from the flu. And this year, we've not had tens of thousands of people die yet from COVID. So why is everybody so worried? What's going on here? Well, there are a couple of differences. So when people who die from the flu, typically, some of the people who die from the flu die in the hospital. They're young people who get really sick and are on the ventilator, but that's only a few at a time. So having worked at the hospital for many years and been sort of in charge of bed control, we had a sense who was there. So even during the worst of times, during the 2009 swine flu, when there were a lot of people with it, the ICU had some people in there with that. But most of the people elderly who die with the flu, the story is something like grandma gets the flu in in February, and then over the next few months, she just never rallies again, and then eventually dies in March or April. And that's clearly tragic, but it's a death that was otherwise likely to occur at some point. In the COVID, these are people who are otherwise up and around, right? So these are people who are going on a cruise, or these are people who are going to church, or these are people otherwise who are fairly vigorous, who die almost all in the ICU. So the problem is, deaths from any reason are problematic. What is most problematic is the way that the COVID uses so many ICU resources. So the tragic story last night on 60 Minutes about the ICUs being full of these people, and they stay on the vents for weeks at a time. And so that's the problem, is the overwhelming of the system, and because the deaths are so much more common. So by the time we get through this, there's likely to be a lot more deaths than from the flu. So someone asked, will we start doing diagnosis by CT scans? Maybe. There was a conference about that today. So diagnosis by CT scan is good because it doesn't have any, you don't have to wait for the swabs to get there. You don't have to send the test away. The difficulty is you have to have a CT scanner, and there are CT scanners in town, but getting it all set up and whatever is a little bit more complicated. So the age ranges. So most of the people diagnosed are older people. There's no babies and kids in it. So most of the people are older people. And just like the rest of the state, our age distribution almost exactly monitors with the state. So if you want to know what our age distribution is, you should look at the state distribution, and that's it. So what are the symptoms that should get testing done? So the symptoms that should get testing done would be fever and cough. So fever and cough are the cardinal symptoms, although there are a couple of people now we're noticing who have only diarrhea and fever. That's a little harder then because they have no cough at all. So you have to be careful. But I think the cardinal symptoms are going to be fever and cough, especially cough with shortness of breath. Now, lots of us get colds and cough a little bit, but we almost never get short of breath with it. So fever, cough, and especially shortness of breath. So how do I feel about self-service? Well, I kind of like people pumping my gas, but I can see why they did it. I mean, this allows gas stations to do much more social distancing. So I think it's okay, although I really like some people pumping my gas. So what about elderberry syrup? So elderberry syrup is a very common thing in Europe, where they like elderberry syrup for almost everything. We don't think it hurts. There's no signs, though, that it helps. Should we go into doctor's appointments? So the answer is, on doctor's appointments, if you can avoid it, yes. And you can avoid going to a doctor's appointment by doing a telehealth visit. And I think most of the clinics in town are set up to do telehealth, either by video or even just by the phone, and they're set up to do that. So we're recommending that people go to doctor's appointments if you have to actually see the doctor in person. And sometimes you do, right? So for example, if you need to have a rectal exam or something like that, you can't do that over the phone. But almost everything else you can do over the phone. Last week I did a bunch of visits by telehealth, and they worked pretty great. These were well-child visits. You obviously then couldn't feel their tummies and listen to their hearts, but you could do everything else, and they were pretty good. So is the first patient getting better? And the answer is, well, while not doing this, generally patients who are past the first few weeks are getting better, although I will tell you that throughout the country, when we look at people who recovered, they've been sick puppies for a long time. So these people, in China, they said they were 6 weeks until people were well enough to care for themselves. So we have been seeing the people when they get this be really, really quite sick. You said previously that people only test positive day to 13. Well, so the story is, I wouldn't say only. So there are some people who tested positive on the first day. There's some people who tested positive as late as the 20th day. But the rate of positivity goes way down after the 13th or 14th day and goes way up after the second or third day. So it's not an absolute thing. It's sort of it's a statistical thing that far and away the most likely time is between the 3rd and 13th day. So we've been trying to find the ones that are most likely to be positive to get us an idea what the rate is. If we sampled lots of asymptomatic people and didn't find it in 100 asymptomatic people, that wouldn't tell us as much as what is the rate in people who are sick. So why can you not release? So the answer is that we have small cities. So if I told you the small city's name and the age group, you could kind of impute what goes on. I will tell you, if you took a map of Douglas County and threw paintballs at it, it's all through Douglas County. So these cases are all throughout Douglas County. So, if I told you it was in one place, it's not like it spreads through the air. So, if they were 100 yards away from you or 5 miles away from you, the risk would be the same because likely you'd be going to the same places. So they're all throughout the county. How does the CT scan show that you have COVID? Well, it's really, I was looking at a few of these CT scans today. It's got a very particular, what's called ground glass appearance on CT scan that's sometimes hard to find on chest x-ray. But on CT scan, it just it just is there at you. So as an emergency dental patient, how can I protect myself? The answer is it's really hard, right? Because, you've got to open your mouth when you're a dental patient. So our recommendation is if emergency dental stuff can be delayed, and sometimes it can with the use of antibiotics or analgesics. So if it can, we would do that. If not, I will tell you the dentists do an incredibly good job at using PPE. So I don't think you have to worry about getting it from your dentist. I think the dentist has more worry that they'd get it from you. So will you speak to how we know if somebody's recovered from COVID? So there have been multiple different definitions of recovery. Some places have used all symptoms resolved and 2 negative tests. Some people have used 7 days after the last symptom. Some people have used 3 days of the last symptom, and some people have used 7 days from the last date of discharge. Oregon has not standardized its definition yet. And so that's why the recovery statistics are a little bit unclear. And that's actually been unclear throughout the world as people use different things. So when will we get the new 5 to 15 minute tests? I hope tomorrow, but I don't think so. So these new 5 to 15 minute tests need a platform called the Abbott ID Now system. We checked today and we don't think there's any of those in the county. Darn it. So we've used other different kinds of testing things. That's just not been one that we think that any of the places in the county have used. And then you need a cartridge, and there's only going to be 50,000 cartridges a day. So that seems like a lot, but that means in Oregon that we would get only 500 for all of Oregon. So, that would be the goal, right? If we could test everybody as easily as I could test for strep or flu, that would be such a game changer, but I don't think it's there yet. So does the virus damage your lungs? Absolutely, positively. These lungs look just ravaged on CT scan. These lungs are not, these lungs are so damaged. Now the good news, we think, is that young people who have otherwise normal lungs beforehand, when they get over this, do recover most of their lung function. But again, you really would like to do the test 6 months after infection, and there's no one in the world who is 6 months past infection. Should we make my caregivers wear PPE who work in my home? And Kim asked this question. So the official recommendation is no. The biggest recommendation is if they are the least bit sick, they shouldn't come to your house. If they are the least bit sick, wearing PPE is not a substitute for staying home. If they're asymptomatic, wearing PPE is kind of up in the air. So it's kind of up in the air. The problem is if everybody starts wearing PPE all the time, we're going to go through it even quicker and we'll run out sooner. So a little hard to know. Now, they would be perfect for one of the homemade masks because the homemade masks work very well for the person who might have the disease. So as I say, they're coming out. I was at Joanne Fabrics yesterday and they're running out of the stuff to make it with. So there must be a lot of these being made. So for patients that have recovered, what was the typical length of stay in the hospital if they were admitted? Well, in China it was 6 weeks. In the US, it's 2 or 3 weeks. So it's a long, long, long time. I can tell you most people who come in the hospital in the past with even a bad case of the flu and whatever, they typically be on the vent for 2 or 3 days and they're off. The stories from New York yesterday, these people are 2 or 3 weeks and then slow to recover. So how does mouthwash work? Well, I wish. People have all these things like heat or mouthwash or whatever. Since this if that worked, then that should work for common colds, because common colds really do live in your mouth and your nose. So hot air or mouthwash should work. This one doesn't live in your nose, so it's impossible for me to see how mouthwash or hot air would work. So how are the people that have been hospitalized been doing? In general, well, I think there have been 3 total hospitalizations and 2 have been discharged. Is there a vaccine yet? Nikki asked. No, that's what I want for Christmas. Actually, that's what I want for Memorial Day, is a vaccine. But vaccines are really hard to make, so you have to sort of pick the right antigen. So somebody described it as looking at a lock and trying to figure out what key is going to work by trial and error. So it's not so easy. And again, we've never made a good vaccine for coronavirus. So this will not only be what kind of lock is it, it's a brand new kind of lock. So how long does it take for the results from the testing to come back? And this is a great question. And so the testing on the 17th was really problematic. We just got those results back this weekend. That is way. I mean, 12 days is so freaking long. Sorry, I said that. 12 days is so very long. And that's unreasonable. However, the results from the other tests are coming back sooner. So 3 of the positives we had today were from the testing on the 3 of the positives we had from today were from the 24th. So that's a 5 or 6 day turnaround. That's a little bit better. You know, really, for this to be right, you need to have overnight turnaround, and we're still waiting for it. So is the rumor that things will be closed until September true? Kelly asks. Well, that would require me to predict the future. So, I mean, the worst future is that we have a lot of cases over the next few months and everything falls apart. We'll still have cases in September. The best hope is that we decrease the curve or flatten the curve, in which case we have a manageable number of cases through the summer, and that hopefully things would die off in the fall. You know, by then, hopefully you'll have much better testing, so you'll be better able to find these cases and isolate them. Because right now, without knowing who's infected or who just has the crud, it's really hard to isolate people. So there's been talks about opening up the country. And I think we can open up the country when we have good rapid testing and an area has declining hospital rates and mostly negative tests when you test people. So we'll get there. I don't know. I can't predict the future. I don't know how long it's going to take, but clearly longer than Easter. So how long does the virus live on boxes, money, other surfaces? It probably lives for a while on those. And so you certainly will be wanting washing your hands after you deal with them. You know, we don't think that's where most of the infections come from, but you know, if you're worried about that, I think you should go ahead and consider alternatives, using your own card rather than money. Waiting for the box to sit around for a few hours before you open it up, if you can wait, or using gloves are all not unreasonable things to do, and so that's what I would do. So please comment on when you think this will peak. You want to guess, or do you want? I mean, the real answer is, well, nobody knows. So, and when people talk about the peak, what they're talking about is a peak in active cases. Right, so what's going to happen is, if you look at the total number of cases, of course, it's going to continue to increase. But the question is, when will the number of active cases peak? That means more people are recovering than are getting new cases. So in China, it took 6 weeks. In Korea, it took about 4 weeks. We've got such a big, disparate country. So a lot of that is, when will it peak in New York? When will it peak in New Orleans? I'm afraid what's going to happen in this country is New York is going to have a big peak. And then next month another city will, and next month another city will. When we talk about when it will peak in Douglas County, the hope is that there's not going to be much of a peak at all, but rather than being like Mount Thielsen with a strong peak up and a strong peak down, it's going to be more like the coastal range, which is a slow up and a slow down. Probably not in the next month or so. Are we still thinking a year to develop a vaccine? Sadly so. I'm hoping that we get it right the first time, and that happens sometimes. You try a vaccine and the first thing you pick works, which would be so great, but that's not always the case. So I think Dr. Fauci said a year to 18 months. I think we have to believe that. So should cashiers wear face masks? And Mindy asked this question. This last week, there's been a lot of interest in the general public wearing face masks. And I think I answered this question last week saying, well, the data is kind of sketchy. And the data is sketchy because it is mostly about the flu, which is a different kind of illness. And it's mostly about people who are experienced in wearing masks. If you're not experienced in wearing masks, you just have to watch somebody touch their face all the time, and they're putting it up and putting it down and pulling it out of their eyes, and it fogs up their glasses so they touch their eyes more. So the concern is when you wear a mask, you're much more aware of your face. And actually, I will tell you, in medical school, the first month of surgery, it's like, I hate this mask on my face, and people have a tendency to touch it. On the other hand, for people who are used to wearing masks, it probably may provide some help. I know that's not a very useful answer, so the answer is maybe, maybe not. Certainly, if you're going to wear a mask, I would recommend one of the cloth masks, because there's not enough masks out there for people to wear new masks all the time. But you could get a couple of these cloth masks and do them wash them and rotate them out. Some of them are pretty cute. So is it risky to order takeout? So the least risky would be to grow your own food in the backyard and then do it that way, but that's not likely for some. The riskiness is social distancing. So if you can have social distancing, you can do it. Some of the now takeout places are having you pay by phone, leaving it on your porch, leaving, and then you pick up the pizza. That seems a pretty safe way to do it. In China, they're doing it in the same kind of way. So how do we know if infected people are staying quarantined? Well, we stay in contact with these people, but we don't have the quarantine police, and so we don't do it. So we almost always try to do this by cajoling people to do that. We know that there may be some people who violate their quarantine order. So people may have heard the story about Rand Paul, a senator from Kentucky, who got tested and should have been in quarantine and yet went out to events, went out to the gym. So, it's really hard to get people to listen to what we say, but we're saying for both people who are infected and people who are symptomatic that they really should stay home. Now, as a public health officer, I can go to court and get a quarantine order, and we can post a quarantine order on the door, and people get a $500 fine or something if they miss it. But guys, we don't want to do that, right? What we want people to do is to stay in. And if people don't, what we do is I give them a good talking to. So I've done that a few times here, saying, look, buddy, what are you doing here going out? You should have to stay home. And typically, and they agree. I don't know if they listen to what I say. So will the virus die off in the summer? And, I don't know. Viruses do tend to be much less prevalent in the summer. So as a pediatrician, when I look at the number of kids who have colds, certainly in the summertime, there are a lot fewer kids with colds than there are in the dark days of February. The dark days of February for pediatrician are pretty dark. Everybody's sick with something. And by the summertime, people get a lot less stuff. So that's the hope. The problem here, though, is that it's getting warmer in New York. It's getting warmer in New Orleans. It's a lot warmer in New Orleans. I mean, New Orleans over the summertime, and yet the disease is really spreading quickly in those areas. So if this was the kind of thing that was going to die off when the weather got warm, I would have expected to see New Orleans just get, nipped in the bud. And we haven't seen that, so I don't know. So again, this is the fifth time. Say again why we're not releasing cities. Every city. There's no city of any size in Douglas County that doesn't have one or more cases. So if you just name all the 10 top cities or the 5 top areas, every one of them has a case. So everyone has a case. You should assume that every city has a case because they do. So when we get rapid tests, not soon enough. So, as I said before, there are a couple of new rapid tests. The newest one we've heard about is from Abbott, but you need to have the Abbott machine to run that. And there's, as best we can tell, there's none of these machines in Douglas County. And they also need special cartridges, and the cartridges will be very limited, so not soon enough. So is the hospital testing patients admitted with COVID-like symptoms? Bonnie asks, and the answer is yes. So the state public health lab is doing admitted patients with respiratory disease, and they're doing those tests on a daily basis. And I'll have these guys figure out how many we've sent to the state lab, but it's a lot. And except for the ones we've noted, they've all been negative. Yeah. So Amy asks, how long will dentists be closed and elective surgeries put off? And the reason that we're asking people to put those off is to conserve the PPE that they would use. So let's say I went in and had my shoulder worked on. There'd be an anesthesiologist who'd wear a mask and gown. There'd be a surgeon or two, a circulating nurse or two who would be using gowns and masks and gloves and whatever. And so those gowns now and masks and gloves would now not be available later on if somebody came in later with COVID. So we would ask them to put them off. Similarly with dentists, they're very good at infection control, so they're using masks and gloves and gowns every time they see a new patient. And so the thought was we should ask them to stop so we can reuse their stuff for the hospital. And indeed, that's what happened. So a few weeks ago, the governor asked for elective surgeries to be elective and non-emergent surgeries to be put off. And then they asked the dentists and the veterinarians too to give that PPE to others who needed it, and we did that. And so that was great because that was a real infusion of new protective equipment for the hospital and EMS. The problem is that's all done, so I don't think we're getting it. So what do you know about Europe saying they'll have an antiviral by summer? I sure hope so. I mean, there's been so much hype here about this coming and that coming. I think at this point I've gotten so sadly skeptical, because I'm not a skeptical guy to start with, but I'm so skeptical about anybody says they're going to have an antiviral by summer. It would be great if they did, but unfortunately, I don't know. And so an antiviral would be great. And somebody said I'm doing a great job. I'm not sure about that. Okay, so if I have lung or heart issues, should I talk to my provider and ask for recommendations? Absolutely. And hopefully your provider will say, you should stay home, because that's really the best thing to do for people who have heart and lung conditions. The other thing that we're asking is that for people who have underlying conditions which are modifiable, that's if you're a smoker, you could stop smoking. If you've got heart or lung issues, get them in good control. So if you happen to get this illness, then it'll be less severe. So should we wear PPE during a workup for possible flu, strep, COVID? Absolutely. Because I don't think anybody can tell looking at you whether you have flu or strep or COVID. And so if you've got an upper respiratory illness, if you're sick with anything, the provider should be wearing a mask, and you should be wearing a mask too. So one of the questions that came up last week is, and you're the first to hear this, is the lack of smell predictive of a positive COVID test? So there's been a lot written about people who already have the infection for a while losing their sense of smell, and the British ENT doctors have noted this. The basketball player who got this noted this. So we did a study during our drive-through on the 24th, and on the drive-through on the 24th, we had everybody smell two cotton balls, one that was soaked in orange and one that was soaked in mint. And there were, I think, 7 who couldn't smell it and 3 who tested positive. Well, the 7 who couldn't smell it all tested negative. The 3 who tested positive all could smell it. So it appears that sense of smell, at least at the early part, is not predictive of COVID infection. And that is a bummer, because unfortunately we thought that was going to work. So there's rumors that the virus was created in a lab in Wuhan. And there's also a rumor that it was created in the US and we brought it to Wuhan. I don't know what the answer is. Probably not. I mean, this is a coronavirus that we know is carried in bats and pangolins. So unless we're thinking that somehow we decided to infect pangolins that now affected people, it just doesn't seem very likely. But, again, it certainly could have been created by anybody who is looking to ruin the world. Because this really is going to take such a hit on the world. And if you look at economic production in Europe, the United States, and China, it's going to go down in a year where it's typically been increasing tremendously. And it's created turmoil in countries. It's created a lot of deaths. It's created a lot of distrust of public health officials. So it's really a nasty virus. So could I believe somebody would create it? Yeah, but do I think so? Probably not. Trajectory rate. So we've tripled in a week. Do we have some numbers as to what to expect? So I'm in such a nerd. So I woke up at 3 o'clock yesterday morning, and I spent 5 hours going through 7 different models of how this virus will spread. So give me a minute here, but there's 7 different models. One is a model which is put together by a group called IDM, which is this think tank in Washington. One model is that the cases will double every 3 days. One model is that that they'll double every 4 days. One model is, well, see what happened in California for the first 19 days of their outbreak. See what happened in New York for the first 19 days and California for the first 19 days. So I have all these down in a really elegant graph of multicolors. And my idea is that we'll triple, the disease will double every 4 days until we have the first 10 days of distancing. And then it'll double every 5 days in the next 10 days of distancing. And then it'll double 10 days after that. So I put this together weeks ago, and the numbers are incredibly close to what I predicted. A little bit actually better than I predicted, but they've been very close to what I predicted, which would suggest that this doesn't really ever stop. But when it's doubling every 10 days, you're going to have a lot more people recovering. So the number of active cases will fall, although obviously the number of total cases continues to increase. So, yeah, there was a first infant death now in Chicago. I only know what I read in the newspaper. So what typically happens in this is somebody will write a letter to the editor of one of the big journals, either JAMA or the New England Journal, and then we'll hear about this, say, this is a kid who had such and such and such and such. Now, there are kids who die of all kinds of things, sadly, car wrecks, suicide, homicides, and different kinds of things, who could test positive for the virus. It's not clear that they actually died because of the virus. They may have died with the virus. So as soon as I know, the very next Facebook Live, I'll let you know, because obviously, I was so proud to say, we haven't had any child deaths, but now there's one in China and one in Chicago. So Mary asks, will a widespread antibody test be available soon? I hope so. But again, as I said before, I've been misled so many times about testing that I don't predict anything. It should. I mean, most times we get antibody tests for a disease a few months after we get it. So basically what you do is you make a substrate that this antibody attaches to, and that's the way you figure out how much antibody there is. So we've got a lot of antibody tests like hepatitis A, hepatitis B, hepatitis C. They're all antibody tests. They're relatively easy to do. We've known how to do these for years and years and years. So it's not new technology or new thing. So I would hope that we would get the antibody test soon. This is going to be so helpful, right? Because it's going to let us know if you had that terrible crud in the middle of February, did you just have the terrible crud or did you have COVID? This would be useful because if we find that people already had COVID and are kind of immune, they then could help out and don't need as much PPE as the people who've not had it. And it would also help us to know, all that crap that was all that stuff that was going around in January. I mean, there were a lot of sick people in January. It was like, what is going on here? And we'll wonder if it was that. So what's your best advice for getting through quarantine for mental health? I always like the uplifting stories. So I saw something on Facebook. You usually don't see much uplifting on Facebook, but this was great. So it was in 2030, I think, or 2040, and they were talking about the COVID 2019-2020 outbreak. And the mom said it was a terrible time. People were laid off from work, and the economy was poor, and everybody was worried and panicked. It was a terrible time. And the kid says in 2030, that's not how I remember it. I remember that you were home all the time. I remember that we had dinner every night. I remember I didn't have to go to school, so I could sleep in late. I remember that I got really good at this video game that I liked. And I remember that we cooked dinner at home every night. We didn't get just takeout every time. So he said it was the best time of my life. So I think we have to look at the positive sides. So the positive sides that I've seen is that maybe we can be really nice to our kids. Maybe we can at this time spend a little bit of time getting those projects done that we haven't gotten before. You can still go outside. And one of the things is that people have been staying inside their house. I would really encourage people not to do that. Now, you can go out as long as you can social distance. So I went out for a walk. I went out for several walks this weekend. And when I went out for the walk, if there was somebody there, I moved 10 feet to the side so they could pass, and I did it. And it slowed my walk down a little bit. But you know what? It was so delightful to be out, to be outside and looking at this stuff growing. So please, please, please do that. Try not to focus on the negatives. Negatives are going to happen with or without you, and try and focus on the positives. I had a lovely call with my mom yesterday, so I think you should try to do that too. So is it possible that the virus is here before we were aware? Absolutely, positively. it's possible. I think less likely, but I won't really know until we have the antibody test. So if somebody says, look, I was sick on the 10th of January, I haven't been sick since, and they have a positive COVID test, it might have been here then. So red around the eyes, true. Have you seen it? So again, on Tuesday, we'd heard about this red around the eyes. So I looked at everybody. I did most of the swabs. I looked at everybody. I didn't see red around the eyes. And so I was trying to think, these red around the eyes, I'll be able to predict who had it. Just like the lack of sense of smell, it wasn't predictive. So what is the current mortality rate in the U.S.? So the mortality rate can be looked at in 3 different ways. And so it can be looked at closed cases. That is, a case gets closed either when somebody recovers or somebody dies. That is the most grim way of looking at it because you tend to die before you recover. And so that number is high. So if I give you the worldwide rate here, so of recovered cases or closed cases, that's either you die or you recover, 19% of those have died. That's really high. If you look at the current death rate, that is the number of cases and the number of people who die, that's 37,000 out of the 785, a little less than 5%. But then you look by country and it really varies. So for example, in Germany, they've only had 600 deaths and 60,000 cases. And so they've really had a relatively low death rate of about 1%. But then you look at other places like Italy, where they've had 11,000 cases and 100,000 cases and almost 12,000 deaths. So they have a mortality rate of 12%. The only people that have been able to get a death rate of less than 1% were the Chinese in the outlying provinces and the Koreans. And I think that's because they got it early. So if I look at Korea here, Korea had 158 deaths out of about 10,000 cases. So they had a death rate of less than 2%. Everybody else is so much higher. And that's probably because most of the other places are not finding all the cases, so the deaths as a percent of total cases is low. Now, I will tell you that the total death rate overall, as much as we're very worried about this, is still on the lowest side here, right? So, we're still talking about fewer overall deaths than we would have in a typical flu season. The problem is, unfortunately, that we're not nearly done with this. So, sorry, I had to look at my phone, but I didn't know that. So is the virus mutating, Renee asks? Probably. RNA viruses mutate all the time, and that's how they work. So, people say, could you explain that to me? So I say, imagine if you had monkeys typing on the keyboard here and they didn't know what they were doing, would you be able to take a joke and change the joke? And you might. Most of the mutations are bad mutations and they die off, but some of them actually are mutations that make the virus stronger. So clearly the virus is mutating, but I think it's mutating at a very slow rate. So how contagious are symptomatic people? This is one of the weird things about this virus. There are some people who don't even infect the people in their family, but then there are other people who are super spreaders and infect a lot of people. So I think the best documented one during this has been a lawyer in New York, in upstate New York, who infected 51 people. He infected 51 people before he got really sick. And he was not by any means like this big guy coughing everybody and hugging everybody. He was just at meetings and depositions and funerals and stuff like that. And he affected 51 people. Another person infected like 40 people at a party. And so there's some people who we think are super spreaders, and then other people aren't spreading very much. So how contagious? It varies. Some people very contagious, some people not as contagious, but really hard. So do you think it's easier on children because their lungs are stronger? Veronica asked, and I don't know the answer. It could be that. Their lungs clearly are stronger, but then we have other young people who have presumably strong lungs who get very sick. So there's something really complicated here we'll figure out. Probably is because their lungs are stronger, but there could be something more complicated. So do you think public schools will have new protocols in the fall because of this? Yes. I think until we get a vaccine, I think the story is you cannot go to school if you're coughing. right? So I think the story is every place is going to have the don't come to work, don't go to school if you're coughing. So I think clearly there will be. So will the mutations make a vaccine less effective? Elizabeth asked. And this is a good question. So mutations can make a vaccine less effective, and that's why we've struggled so much with an HIV vaccine, because the HIV vaccine, HIV mutates very quickly. And so, the vaccine that looked like it was going to work last week won't work the next week because of the mutations. We do not think this mutates as fast as the HIV virus, which is the fastest, or as much as the flu, which is pretty fast. Coronaviruses in general mutate a little bit. Some viruses don't mutate very little at all, like herpes viruses mutate almost none. So would you let your kids junior high age see their friends but keep 6 feet outside? Well, let's see. So the story is, yes, you can do things if you can adequately social distance, but really, kids are kids, and I think they're going to want to be close to their friends. So the recommendation is not to have kids unless you can somehow enforce the social distancing. So can you have flu and COVID at the same time, Diane asks, and the answer is we don't know, because many of the cases where people get tested, they say test first for flu. If they're positive for flu, treat that and don't test for COVID. So we are not going to really know yet whether you can have flu and COVID at the same time. It turns out that there was a thing called the Seattle flu study, where they looked at everybody who was sick with a flu-like illness, and they checked them both for flu and for COVID. And so when those results come out, we'll know if that's the case. There are some suggestions about that. So which blood types are more common and less common to get it? Well, there was a talk of a difference between A and O. And again, we don't know if those differences are because different blood types are more common in different ethnic groups than others, or whether there's a real risk for it. The deal is you can't change your blood type, so I don't know whether this really makes any sense. There are certain diseases that are more common with one blood type or another, but it may also be because certain blood types are more common in certain ethnic groups than others, and clearly some diseases run in certain ethnic groups. So explain high risk. So really high, you want to know high risk? Smoking, driving without your seatbelt, that's really high risk. I think probably what the person meant here is what's high risk for people to get this. So age is clearly a risk factor, cardiovascular disease, underlying respiratory disease, high blood pressure, and obesity all seem to be risk factors, not for getting the disease, but for having a bad outcome. So an obese 75-year-old with COPD is much more likely to die than a young, healthy 25-year-old. So those risk factors will always seem to be additive. So age, obesity, respiratory symptom, chronic respiratory disease, and heart disease all seem to be additive. So when you put that together, an 85-year-old with all those things has even a greater than 15% risk of dying. So you need to be really careful. So Lori asks, what can we do now to prepare for when Mercy cannot handle all the cases? Well, our plan is never get there. So our plan is with our great epi team and our epi strike team and everybody else to really get people surrounded when they have the disease so they don't spread it. This is a wood table, so knock on wood, I think none of our cases have spread it to anyone other than household contacts. So when we looked around and we looked at all the contacts of these people, we don't think any of the people we've identified have spread this to anybody else because they did very good social distancing and quarantine. So if that's the case and we can surround all these cases, we may not get this big surge. We're still going to get some cases, but we may not get this big surge. The other thing is people have to social distance because otherwise they're going to unknowingly get it. So that's the deal. However, we have to consider the possibility that the hospital at some point could get overwhelmed. And what are the plans? And there's a lot of plans going on for alternative care sites, for step-down units, for using other beds and other methods. So I will tell you there's a lot going on. I don't think anything is crystallized enough yet that we can actually detail what it is. But I tell you, we have some great minds working on it. Yeah. So there's questions. What about alternative therapies like vitamin therapy, ozone therapy, and nebulizing hydrogen peroxide? Elizabeth asks. Well, so we've tried vitamin therapy for lots of things. So vitamin therapy has been all the rage for lots of things: sepsis, pneumonia, whatever. It doesn't seem to work for any other kinds of pneumonia. So there's nothing specifically to make me think it's going to work for this. Hydrogen peroxide therapy may work for localized things. So you've got an abscess, you put some hydrogen peroxide, it bubbles away, and that works okay. But nebulized hydrogen peroxide doesn't work for any other kind of illness, so I have no reason to think it would work for this. And ozone therapy, I'm not sure it has been adequately tested, so I don't really know. So, one of these alternative therapies would be great. And I'm told now that there's thousands of trials where, ICUs that have a bunch of people try one therapy on one group and not on another, and they look to see if there's a difference. And so the first trial that came out, which was this randomized blinded study, that is, some people get the treatment, some people don't. The people take care and not sure whether they got the treatment or not, and seeing their difference, unfortunately showed that there was no advantage of several antivirals. So will Douglas County try to get an Abbott machine? Absolutely, positively, but I can tell you that Douglas County, as well as 30,000 others, are looking to get this machine. So the machines are not now available, but we're searching high and low to see if somebody maybe has one in a closet that they can get. But again, I think the limiting factor on the Abbott machines is going to be the cartridge that you need. So the goal would be to have adequate cartridges and adequate machines to do this. I don't think we're gonna get that, but we're gonna try really hard. I called today. They were, not surprisingly, they were busy. Okay, so we have our hotline is still up, 541-464-6550, 541-464-6550. They're there till 7:30 at night. They're actually getting far fewer calls, which hopefully means that people have got most of their questions answered. But they're doing a great job. So if you can help out, especially if you're a doctor or a nurse, that would be great. We also need call screeners, so that would be great too. I think the people who are doing it are actually having a good time as well as doing a good deed. The other thing I would say is recovers.org. Recovers.org is a website where people have stuff that they can do and people have needs get linked together. So for example, older people now who are sort of at home trying not to go out can say, I need somebody to buy me groceries, and a young person who's out and around can go ahead and buy groceries and leave them on the porch. That is a perfect example of what we can do for each other, and I'm really, 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 really hoping that more people take advantage of that. The other thing is the testing clinic tomorrow at 12:30. I think we have people to go ahead and do it, and we have enough supplies for Tuesday, and I think we have enough supplies for Friday, although after that our supply of swabs is going to get really, really short. I was a little late today because I was working with the pharmacy director to see if we can get more of those swabs and things. So we're working on it. And I can tell you, we have so many people working so hard on this. And people said if I've had any regrets during this, the only regret I have during this whole thing is I haven't thanked people enough. And I tried, and they asked me on the radio all the people to thank, and I kind of stumbled, and I didn't include some people. So I am very grateful for all the people that have helped, even if I forget to mention you. So that's the deal. Are we out of questions? Pretty much. Okay. Again, it's Dr. Bob Dannenhoffer, Public Health Officer from Douglas County, with another Facebook Live event. I think we'll probably do another one on Wednesday and then again on Friday. So again, if you have questions, please do the questions. I've been trying to answer some of the questions on Facebook, but I'd rather do that orally, actually, so everybody hears, rather than do it on Facebook. So if you have those questions, put them in, and we'll do these again on Wednesday. Again, Dr. Bob, take care.